You can go ahead. Okay. So, hello, my name is Dartina Dunlap, and tonight I will be presenting to you on resumes and cover letters. And we're going to be covering what a resume and cover letter looks like for a clinical medical assistant. I am a career counselor in the Office of Career Services at Governor State University, where I have been serving students, alumni, and community members in the area of professional development for the last 10 years. I'm very excited to be able to share this presentation tonight. So with that being said, I'm going to go ahead and I'm going to get started with the presentation at this time. Okay.
Dartina, while you're setting that up, can we have a few words?
Absolutely.
Yes, I just want to, on behalf of our Extended Learning Center and also Governor State Workforce Initiatives, I'm your director, Michael Townsend. And also I have with me is our job coach, Mrs. Brown. So I want to say welcome to Rita for taking your time out to be here with us this evening. We would say a big woo woo, but we really mean it from the bottom of my heart. It shows your determination to be here. There should be maybe 20 others, but that's okay. We're still rolling, and we're so fortunate to have Ms. Dartina here as a professional counselor. And you're getting the best this evening, okay? So if I'm gonna turn it over to your job coach. Gina, you wanna give a few words, and then we'll let the master of the resume and job-related things do her thing to help us become successful. Gina?
Yeah, hi everybody. My name is Gina Brown. I am the career success coach here at Governor State University through the School of Extended Learning. You guys may have recognized me via your email because I'm pretty much sending you guys a lot of notifications. But if you ever need any information, you ever need to reach out to me, please don't hesitate. You can always contact me via email, and I'll also be placing my email into the chat so that way you guys can have that for future reference, so that way you guys can jot it down. Alrighty, I'm going to segue to Ms. Dartina Dunlap, and her presentation will begin as of now.
Thank you, Gina. So with that being said, we're going to go ahead and move on to the presentation. So I wanted to just go over two general descriptions of clinical medical assistant and medical assistant, just so that we're clear on which role that you're possibly applying for, whether it's clinical medical assistant or medical assistant, which while they're very, very close, there's some slight differences that one do as opposed to the other. So for a clinical medical assistant, is a clinical medical assistant is a medical assistant who specializes in clinical work. Medical assistants' general duties typically consist of the following tasks, which are recording patient history and personal information, measuring vital signs such as blood pressure, helping physicians with patient examinations, giving patient injections or medications as directed by physicians and as permitted by state law, scheduling patient appointments, preparing blood samples for laboratory tests, entering patient information into medical records. And then a medical assistant is a larger healthcare facilities. Medical assistants will typically specialize in either administrative or clinical work. Clinical and medical assistants duties can vary depending on state law. However, their general duties typically consist of the following tasks, which are performing basic laboratory tests, disposing of contaminated supplies, sterilizing medical instruments, instructing patients about medications or special diets, preparing patients for x-rays, removing stitches, and drawing blood. So you can see how they're very, very closely related. But for the sake of this presentation, I did want to point out just, some of the slight differences in what they do. Now, when you are creating a resume, the first thing that you want to ask yourself is, should I use a template? Until very recent, I did not actually include this as part of the past presentations that we used to do in the Office of Career Services. However, as times have changed, more and more people are using templates. And so I'm getting that question quite often. And so I wanted to address it and I started to address it in our presentations over the last year. So I just said, you want to look at that and you want to think about it. Now, in here, we normally will say, please do not use a template. And there are some reasons that we include why you shouldn't use it. But now I tell students, alumni, and community members, make yourself a pros and a cons list. Which one works better for you when you think about how you want to be represented for a particular employer? So some of the pros are, it's easier just to plug in your information. You don't have to think about where things go. You just put them in whatever the slots that are listed on the template. The structure and formatting are automatic. The layout allows you to present information in bite-sized chunks, which increases legibility. And then some of the cons are, it appears that the candidate took the easy way out sometimes. It's the same as everyone else's. Even though you're trying to be unique, you are being more like everyone else by using a template. Candidate didn't invest the necessary time to tailor their resume for the position. A lot of templates are substandard, and many times it becomes harder to add or reorganize information. That is perhaps the biggest issue that I see with templates, which is why I always discourage people from using a template. I get so many people who go and they try to make changes with their document. And as time progresses, it becomes very hard to make the smallest of changes. And they will contact me to help them. And so sometimes I can help and sometimes I can't. Some templates are so rigid that you can't strip it of the format. So a lot of times we will say, don't even copy and paste from a template because it takes the same principles over to the new document. You want to start completely fresh with your document. So you want to think about the pros and the cons, and you go from there and decide which one works best for you. If you're not concerned about making changes in the future, then by all means, you can choose to go with it. However, I'm going to just say at first glance, it's in your best interest, in my opinion, not to go along with a template, but to create one from scratch. The next thing is, how do you organize your resume? So that's really important. The organization, the formatting of your resume is huge. You want a prospective employer to be able to look at your experiences and make a decision whether or not you're a good candidate without having to guess, without having to go through every line of your resume. If they have a lot of resumes to go through, there is a great chance that your resume may not even make it to the top of the list of resumes that they look at. If they're using software, it may get pulled based on the integration of the words that you've used. And for that reason, we'll talk about that a little bit more later in the presentation, but also integrating the words in your particular field. So you have two sets you have vocabulary from both sides. First, you're going to have the vocabulary that's you starting your descriptions with. And we actually have a list of those words on our resume guide to help you. Then you have a vocabulary list of the words that are used in your profession. And so both set of words are important to actually have on your resume to describe your experiences. You want to arrange your sections in order of importance. So you're going to ask yourself a few questions. Which is stronger, my education or my work experiences? Now, what we mean by that, if your work experiences in the particular field that you are applying for are strong, meaning that you've had some years of experience in that field, and I would say anywhere from four to 10 or more, but anything less than 4 years is really not a strong foundation. And so your education or certifications will go above that. But other than that, it will go below. So those are some of the things that you want to start thinking about based on you applying for these positions and making sure that your resume coincides with the work that you're going to be doing. So you may have limited experience, and if you do have limited experience, there's no need to fear. Simply look at the experience that you have and you create a section for it so that it stands out to the prospective employer. That's really important. You want to make sure that you are organized in your formatting and that you are strategic in how you are placing those sections on your actual resume. So you want to get started. What do you include? Your contact information section would include your name, your address and phone, your email address, your LinkedIn address. Now, a lot of times, if you are applying on a job website, you may not want to include your physical address. You may just include the city and state, or you may include just your email and your phone number. That is quite acceptable. I always encourage people, even if you see it on another website, a job search website, be sure to go over to the organization's website and look the position up there and go ahead and apply there. So that way you apply directly to the website and you can actually put your contact information on the actual resume with ease. You're going to include your education, which includes universities, community colleges, technical schools, and etc. Whenever we say location for a resume, we mean the city and the state. There is no need to worry about including the exact address. You want to just put the city and state. So you're going to put your degrees that you've earned by putting the month and a year in, or that you are anticipating. So in that instance, you would just put anticipated spring 2023 or anticipated June 2023. But the general way to express the degree that you will get is by using the words anticipated or expected. You also can include your GPA and your honors. And those are going to be huge things to put on your resume in relation to demonstrating that you have strong work ethic. So that is really the basis of why you would put something like that on your resume. It's important for them to know that you have a strong work ethic, and it's demonstrated through that. So you're going to include for the experience section, the company or organization name that you've worked for, the location, again, city and state, your position title, the dates of employment or involvement, and then descriptions of your responsibilities, your duties, achievements, etc. So when we say experience section, I just want you to know that experience section does not mean that it has to be paid work. It can be an example of all other experiences that you've had, such as, it can even be maybe a special project that you've worked on. That would be a very good way to demonstrate a skill set for a prospective employer. And so just remember, this section is not limited to work experience. You can expand it. You want to make sure that you always select content that supports your qualifications and matches your job descriptions. So what have you done already that aligns with the description of the position? So one of the most important things that you want to do when you are submitting a resume for a job, you're going to look, when you're looking up that job, you're going to look at what it says in the description section. What the expectations are. And you're just going to make a little checklist. Everything on that list that you've done, you're going to check it off. And then you're going to go to your resume and you're going to make sure that it is included on your resume. That give you a high probability that it will be identified and it will match with the description of the actual position. Therefore, if there's software that they're utilizing to pull up your resumes, that is more easily identifiable and will be pulled possibly to the top of the pile. Include work experience, community involvement, volunteerism, as I said before, special projects. I mean, just about anything that you can think of that's been experienced where you've utilized the skills that you need in the role as a clinical medical assistant, then you want to make sure that you're covering that on your resume. So are you investigating, researching, coding, identifying coverage? Whatever you're doing or have done that may be somewhat related to this field, you want to make sure that you include it on there and that you have great knowledge of how to put on your resume, even your transferable skills that are really related to that as well. As I stated earlier, you want to make sure that you organize things by the order of importance. So what experience do you have that is most related to this position that you're applying for as a clinical medical assistant? How old is the information? You never want to go back more than 10 or 15 years on your resume, but if there's an experience that you had that is really related to what you're trying to do or where you're trying to go, you want to make sure that you do include it. So if it happened to be 16, maybe 16 years old, you can put it on there. Just because you are showing that it's related experience. But then I would also encourage you, especially since it may be old experience, that you would put related experience. And it may actually be experience that you had maybe in a medical facility, but you didn't have that title yet because you didn't have that certification. But there were some times when you did things or operated in a role doing some of the things that this position would require you to do. So it would be totally okay to include that on there and make room for it so that it becomes a section area of itself. And that way, a prospective employer is able to see that and retrieve the information quickly. So your skills utilized include social perceptiveness, meaning being aware of others' reactions and understanding why they react as they do. Active listening is important, is huge, which is giving full attention to what other people are saying, taking time to understand the points that are being made, asking questions as appropriate, not interrupting at inappropriate times, speaking, which is talking to others to convey information effectively, reading comprehension, understanding written sentences and paragraphs in work-related documents, then critical thinking, which is using logic and reasoning to identify the strengths and the weaknesses of whatever the prospective situation is. So one of the things that I did here is I wanted to make sure that we listed some of these skills and think about them in terms of these are skills that you can pick up from any roles. They're transferable skills, but they are skills that are directly related to what it is you will be doing. So the analytical skills, the ability to be detail oriented, interpersonal skills. The interpersonal skills is huge, especially in this industry of being a clinical medical assistant, because you're going to be engaging with others all the time. And so your ability to be able to actively listen to them and gaining the information that is needed from them is huge. It's important. It shows and demonstrates that you have the ability to be thorough, because the better you're able to engage with them and communicate with them, the more reliant you can be on the information that is being presented and or recorded. Technical skills are important in just about every industry now, but especially in this industry. You know, you use basic clinical instruments so they can take a patient's vital signs such as heart rate and blood pressure. Organizations such as that will be hiring for a medical assistant, they want to know that you have the capability of doing these things. And while they may seem minute to some, they are huge to a prospective employer because they want to know that you not only can use them, but you use them well. So that is the perfect opportunity where if you haven't had much experience in this field, but you have been involved in maybe some clinics where you did maybe some volunteer work, and in doing the volunteer work, maybe you were the person who took people blood pressure. This would be an excellent opportunity for you to highlight it on your resume. Now, when looking at the descriptions that you put on your actual resume, you want to consider this formula. You want to consider taking an action word plus your journalistic approach. And that ends with you having a very detailed description of what you do. So what do I mean by that? And there's a reason why I kind of just put it in this format, is just to get you to kind of look at it as a formula, an equation. This, you know, this plus this equals this. And that way you can go through your descriptions and see if it's meeting the criteria. So using that action word, here's a list of some appropriate action words. Again, we have more that are listed on the resume guide that we actually have on our website. You could go to page 5, you would be able to pull the list of words. But more importantly, you want to make sure that you're also integrating the language in the field. So here are the words that I put on the presentation just for you to get an idea of what they look like. And then I'm going to talk to you about the journalistic approach. So the journalistic approach is, we say instead of putting 1, 2, or maybe 3 words for your bullets, you want to give them more of a detailed description of what you did. And so how you go about doing that is you answer a couple of questions. With whom did you do the work? What duties did you perform? Where did your job fit into the organization? What goals were you trying to accomplish? What timelines were you working under? What procedures did you follow? And the questions are actually they're interchangeable, because when you think about where did your job fit into the organization, you can also think about it in terms of where. And you can name a clinic. And that is a description of, you know, where you did the work. And so I want you to look at this journalistic approach and ask yourself, which of these questions can I answer very easily to help them understand what I did? We don't expect you to answer all the questions, because that would make your bullet way too long. That would become a paragraph, and that's not what you want to do. However, you should be able to answer at least 2 of these questions. With whom did you do the work? What duties did you perform? Or with whom did you do the work, and why did you do the work? You know, that's always a good question to answer. Why? And, you know, that's the explanation of the description, which makes it even more helpful to the employer. So how do you develop your descriptions? You know, you want to make sure you demonstrate your functions and your skills. So for instance, if we looked at the words record vitals for patients, that's perhaps what the statement would look like before we use the formula. Now, after using the formula, we would say record vitals to ensure accurate health information for patients. We told what we did, and we told who we did it for. And it is just as simple as that. You answer 2 of those questions and you only have 1 bullet. So some of the duties of clinical medical assistants, I actually just started to list some of the things and just, so that we can talk about that. They interview patients to obtain medical information and measure their vital signs, weight, and height. They clean and sterilize instruments and dispose of contaminated supplies. They record patients' medical history, vital statistic or information such as test results and medical records. They explain treatment procedures, medications, diets, or physicians' instructions to patients. They prepare treatment rooms for patient examinations, keeping the rooms neat and clean. Again, that is actually something that a person might do prior to actually even having their certification to be a clinical medical assistant. They may have done work like that as a volunteer. Those are some of the duties that they may have been responsible for. And if that's the case, you definitely want to make sure that you describe it on your actual resume. Again, here are some more areas, especially in relation to transferable skills. So your main job is getting information. So you observing, receiving, and otherwise obtaining information from all relevant sources. Documenting and recording information, working with computers, updating and using relevant knowledge. So keeping up to date technically and applying for new knowledge to your job is very important. It's very important that you are always seeking to stay abreast of new software that is being utilized, new technology that is being applied, period, to what you do. That's going to make you a highly dependable medical assistant, and is going to put you in a position where you will have opportunities. You'll become known as that clinical medical assistant who knows how to get the job and who's well informed and is competent. And those are the things that you want to be able to communicate. So again, these fall up under technology. And I thought it was important to include them on here because there is a lot in the area of technology as it relates to this position title. And so it's important for you to know, especially if you have any knowledge of the medical software like Epic systems, healthcare common procedure coding systems, all of these things are important. And so I thought it would be worth mentioning. Now, here's the other side of that. Maybe you have technology skills and you've worked with different software, but not necessarily in the healthcare field. It is still important for you to put that on your resume, because what you're demonstrating is while you don't have knowledge on that particular software, you do have knowledge on other software and you are capable of organizing and utilizing those systems, which means that you're probably more likely able to grasp the software that they're going to be utilizing in the role that you are applying for. So when you think about your resume, there are a couple of things that I want you to remember now. I kind of struggle sometimes with this part because within the last year or so, well, even before the pandemic, but especially since the pandemic, nobody is really taking their resume into a job or organization, right? But in the event you are handing your resume to someone, maybe perhaps a networking event or something similar to that, you would want to use white or off-white resume quality paper. Please do not fold the paper in half. Make sure it's crisp. You don't want to print on both sides, just one side. You also want to make sure that your font is 10 to 12 points. And I always say, make all of the font the same size. It's just easier and it keeps the sections from looking too exaggerated, like the heading more exaggerated than the actual text. However, don't go smaller than 10. But if you go to 10, you don't want to make your name any larger than 14. So The number that you want to look at when it comes to creating your text for your name should be 14 to 16. When it comes to the actual text of the resume, it should be 10 to 12 points. Be sure not to use non-decorative typefaces, and make sure that you stick to that. That's really important. And that keeps your document along with the next bullet. Avoid italics, bold, and underline words. You don't have to avoid them in and of themselves. However, combining them and doing all three, that is when it becomes too much. And that's what we're meaning when we say that. Which is the same thing with the non-decorative typefaces. You want to stick to that because you don't want your document to look too busy. It's really important that it doesn't overwhelm the reader, and that when they pick up your resume, they see it as something that they can kind of skim through very quickly and pull out the information that they need. So with that being said, I am going to show you an example of what the resume could look like. And always be sure to get someone to proofread your resume, because after you have worked on it, you have to remember you've just been constantly looking at it. So sometimes we miss things that others may see because they are literally a fresh set of eyes. Also, when you're looking at it, at some point you want to stop, put it away, and go back a day or two later. That always helps, because a lot of times, our mind can play tricks on us. We could think that it is saying one word, and you may have skipped that word altogether. And so you want to make sure that you have someone to look at it and that you've looked at it properly. And another reason is because you actually want to just get familiar with the document that you're presenting. So no matter what the question is, if the question is just based on the resume or not, you're able to articulate that information to them well. So along with resumes, it is also important to have an effective cover letter. And yes, you will need more than one. I get that question a lot. And when you are creating a cover letter, even if you think in your mind, I'm just going to have a general cover letter, there are certain points in that cover letter where you need to make it unique to the employer. And that's going to be very, very important. So what is the purpose of the cover letter? It is to introduce you and your resume to the employer. It helps to state the position that you are applying for. It details why you are a good match for the organization and or the position. And it provides a sample of your written communication skills. Now, many years ago, the resume, instead of having bullets, they would encourage some people to, and I say some people, but especially if perhaps you were someone in higher ed, you would be using paragraphs instead of bullets. Now, one of the reasons that they would do that is because they would also have a sample of your writing. But today, that is not the case. They want bullets because it's easier just to pull your information out. However, your cover letter is used so that they can gather a sample of your written communication skills. How well do you write? That's important to a prospective employer, especially if a lot of your job includes you writing, recording information. It's going to be really important that they are comfortable with your level of writing skills. So what do you write? Well, this is the formula for the opening paragraphs. So basically there are 3 to 4 paragraphs in this. If you do not have experience in this field, you're just getting in the door and wanting to get that experience, you're going to have 3 paragraphs. You only have 4 paragraphs if you already have an extensive experience in the particular field. So in the first paragraph, you're going to state your purpose for writing and applying for the position. According to your website, you are hiring for the position of, and then you could put the position of clinical medical assistant. And then you move forward and state that you would like to apply for that, you are applying for that, and that you have received your certification in this area. You can give some details such as when, including the month and the year, or if it's expected. Then you move on to the body of your paragraph, which you're going to highlight your qualifications, your experiences. This is an opportunity to sell yourself as a competent and committed professional. This is your time to really stand out. This is your time to demonstrate to the organization that you have the skill set to operate in this role. But you don't only want to show them that you have the skills to operate in that role. You want to show them how you fit into the culture of their organization. So you're going to identify something or some experience or some population, whatever that information is that you are able to identify when you do your research, whatever resonates with you, that is what you're going to attach yourself with. So an example of that would be, as a counselor, we oftentimes will look at a mission statement, because a mission statement is very important to the survival of an organization, in my opinion. That mission statement is the guiding force in what the institution goals are and how you can actually help meet those goals. So we may say, according to your mission statement, it states the following: I too believe in these principles and have done the following. And then you can go and talk about what those things are that you've done that are closely related to the goals of that organization. Now, I said a lot of times counselors will do that. So I understand that, not all professions want to go straight to the mission statement. But I say go to their website and find out something about that organization that stands out to you and helps you to be able to relate back to them who you are and how you fit with that, that principle or that goal, whatever it is about them that you actually like. And then it's that closing paragraph, and this should always first, you're going to reiterate your interest in the position. Again, I'm very excited to apply for the clinical medical assistant position. I look forward to meeting with you. And then you could go ahead and you could give them your contact information again, such as your name, such as your email address and your phone number, or one or the other, whichever you choose. And then what you're doing is you're just pointing them to the next step, right? And so these are the things that are really, really important when you actually are going through the process. What I did was I wanted for you all to have an example of what the cover letter would look like. So here I kind of just drafted one for you to get an idea of what it looks like when you are creating a cover letter for the position. So I'm not going to take this time up to read it to you. However, if you have any further questions about it, you are more than willing to reach out to me, and we can talk about ways that you can create a cover letter based on the experiences that you have. With that being said, do I have any questions?
Yes, one question, just one.
Yes. No, it don't matter.
For the experience, since will be my first job in the medical field,
Okay.
as far as that, because I've always worked in warehouses. So
Okay.
would it be helpful for me to take some online courses for like technical, so I can build on my educational side, since I don't have much experience as far as medical?
No, actually, that's a great idea, just to gain more insight into technology realm. I'm not gonna tell you to go out there and just sign up for a whole bunch of courses, but also remember there are workshops that happen in relation to technology as well. So you can do a little bit of both. When you say technology, are you talking about in general, or are you talking about in relation to the software for the healthcare facilities?
In relation to the software, because I think you mentioned some of the software that will be included in that.
Yeah, like Epic.
Yes.
Yeah, I think that would be a really good idea to seek positions. You will seek places that actually do the training for that, or quick courses. All of those things would be great, because see, what ends up happening is, if you don't have the experience but you're demonstrating that you have sought out knowledge in that particular area, that still is demonstrating that you are a hard worker or you have strong work ethic, right?
Yes.
Yeah. You have any other questions? Because the floor is yours.
No, that would be it.
Okay. I heard you say that you have been working, did you say factories?
Yes, because I came across this program. I went through the career choice from Amazon.
Okay.
So I just thought it would be a good fit to try to branch out and do something different. So that's why I applied.
That's great. Let me ask you a question. Do you have any volunteer experience?
No, the closest experience I have had is when I worked in the senior care building as a activity aide, but I'm not quite sure if that's relatable.
It's very relatable. It's very relatable. Now, in this work, see, these are the type of things that I was talking about in the presentation. You may have volunteer experiences that they line up with where you're trying to go. Now, of course, it's not in depth like what you're going to be doing, but there may be some aspects of what you've already did working in that facility that will be helpful to put on your resume. So at least you have something where you can put on, volunteers, community involvement, or related project, related service, any of those headings. But it stands out and is more unique than the actual work experience that you've had. So in your instance, you actually could put work experience, and those will be the things that you've done in the factory environment. And then you can have another heading that talks about related experience. So related experience would be related to the certification that you have. Or, like I said, you could call it community service.
Okay.
Yeah. Okay. Well, if you don't have any more questions, I would just like to thank you for attending the session tonight, and to say that if there's anything that I personally can do to assist you, please feel free to reach out to me. I can be reached at area code 708-235-7346. And again, my name is Dartina Dunlap. I hope that I've said something here tonight that will be helpful to you in moving forward in your new journey, okay?
Okay, thank you so much.
You're so welcome. So at this time, I'm going to ask if Dr. Townsend wanted to say anything, or Michelle, or anyone else.
I just want to say again, Tarita, thank you so much for being a
Yes.
champion tonight, for
Yes.
coming out and just standing up. That's what it's about, having the courage and belief to stand up and take advantage of a wonderful professional deliverer. I can't imagine what the salary would, the cost would be for you paying for a session like this with somebody as highly skilled and very personable as Miss Dunlap here. I mean, she laid it out, all the experience that she has, she makes it down to earth, and that's really a skill. So again, thank you so much, Tarita, for being on this phone call. You got it. Just continue to reach out and keep moving forward. And you will use what you have at Amazon because they hired you there because you brought something. Okay. Remember that you bought something. And so you're just adding a little bit more to it. Okay. And this is your time this evening, as Ms. Dunlap mentioned, to ask any kind of questions. There are no silly questions. There are no small questions. It's about having the courage to ask what you need. Okay. And you got her to call upon. And she's not from some small place you never heard of before. She's from Governor State University. She's one of the finest. So you're so fortunate. And I just thank you so very much. Now, our job coach, Ms. Brown, are you there? Ms. Brown is going to be the person that's going to take you by the hand and help you out too with getting that job. Okay. Ms. Brown, anything you want to add to it? I am through. As they say in the TV world, I'm throwing down the mic in a positive, soft way. Okay. And thank you again, Ms. Dunlap. Thank you. Okay. Ms. Brown, you there?
Yes, I'm here. Can you guys hear me?
Yes.
All righty. I do just want to say thank you for attending. But in response to the question that you asked, you did state that you felt that you may not have enough of the industry related skills. With you working in that warehouse setting, that is actually quite a great transferable skills that you have there, that you possess. That transferable skills, you have attention to detail. You have the ability to source and locate pertinent information as well as pertinent supplies. You have the ability to be able to locate data based off of written or technology descriptions that you're receiving via, if you have some type of location software that you're using. That is all a transferable skill. So please just always remember, never downplay the experience that you have. That's always a stepping stone. That's always a building block that you can utilize to progress your future. But I don't want to get too long-winded. I know today has been a long day for everyone, but I want to thank you for attending this presentation. And I also just want to ensure that if you need anything, if you have any questions, you want any form of assistance or any advice that can possibly be given to you, please reach out to me. My email is listed in the chat. Please reach out. I'm very responsive. If you need anything, I'll always be there for assistance for you. So once again, thank you for attending this presentation. And if there are no further comments, that will conclude our presentation for this evening.
Thank you so much for that encouragement. I really appreciate it. And I will be writing those tips down. Thank you so much.
Oh, you're very welcome. Once again, if you need to reach out to me, my email is in the chat. Please just forward over an email and I will get back to you.